Welcome to our pediatric nursing quiz. Let's put your knowledge to the test. In today's challenge, we're covering 4 essential areas of pediatrics: respiratory assessment, growth and development, blood disorders, and pediatric cardiology. There are 3 questions per topic, 1 easy, 1 medium, and 1 hard, worth 1, 2, or 3 stars. After each question, we'll give you a moment to think and then we'll reveal the correct answer along with a quick explanation. Ready? Let's dive in. During the inspection phase of a pediatric respiratory assessment, which observation would indicate increased respiratory effort?
You'll assess the respiratory rhythm. Is this regular, is it irregular, or periodic? You're going to look at the depth of respirations. Is your patient breathing deeply, or do they have shallow breathing? What is the quality? Are they working to breathe, or are they calm? If it's unlabored, that's normal. They're calm, they're breathing well. If it's labored, that means they have increased respiratory effort.
An increase in tactile fremitus during palpation suggests which condition?
Next, the clinician will do tactile fremitus. This is where the clinician will assess the density of the structures below the skin by feeling for vibrations as the patient says 99. An increase in tactile fremitus indicates denser or inflamed tissue, and that can be caused by certain diseases such as pneumonia. A decrease suggests air or fluid in the pleural space, which can be caused by conditions like asthma.
During auscultation, the nurse hears harsh, high-pitched sounds that are primarily heard on inspiration and suggest upper airway obstruction. What are these sounds called?
Last, you're going to check for stridor. And this is a high-pitched wheezing sound caused by a disruption of airflow in the upper airway. There may be a foreign body obstruction, mucus, or edema that blocks the airflow through the upper airway.
At what age should a healthy infant approximately double their birth weight?
By 4 to 6 months of age, they should have doubled their birth weight. So that's a good rule of thumb to remember.
A 2-year-old recognizes a restaurant sign and becomes excited, expecting a meal. This behavior reflects which developmental stage?
And that's the preoperational stage. It begins about age 2, it ends about age 7. This is a stage, it's marked by symbolic thought. So that is the goal of this stage. Symbolic thought means the ability to understand that a word or object can stand for something else. So for example, when I took my kids, when I drove them down the street and they saw the McDonald's sign, they knew they might be getting a Happy Meal, and they get really excited because the McDonald's sign stood for Happy Meal to them when they were toddlers.
A preschooler tells the nurse that the sky is sad because it's raining. What cognitive concept does this demonstrate?
Animism is another fun way of thinking that preschoolers are known for. So this means it's when they refer to, when they really believe that inanimate objects such as plants, foods, even the weather have lifelike qualities. For example, a preschooler may believe that the sky is sad when it's crying, or that a flower is happy because it's blooming.
The nurse is assessing a child suspected of having iron deficiency anemia. Which of the following findings are consistent with this condition?
These are the most common signs and symptoms of iron deficiency anemia. The patient's going to look pale. They may be irritable or fussy, and they're going to lack energy and tire easily. Maybe this patient was previously active and now they're laying around. They just don't want to go run and play. Tachycardia, or a fast heartbeat. The heart rate's going to increase to try to distribute the oxygen around. There are less red blood cells, and each has less oxygen carrying capacity, so the body's going to compensate by increasing the heart rate to deliver the blood and oxygen to the tissues. A sore or swollen tongue. This is called glossitis. Low levels of iron are going to lead to low levels of myoglobin, which is a substance in the blood that plays a role in muscular health, including the tongue. An enlarged spleen, and something called pica. Now, this is when a patient wants to eat items without nutritional value, such as dirt or ice, and the reason for this is unclear. When a patient presents with these symptoms, they should be evaluated for iron deficiency anemia as a possible cause.
A nurse monitors a patient receiving multiple blood transfusions for aplastic anemia. Which complication should the nurse watch for?
While there's generally no limit to the amount of transfusions that can be given, there is a risk to receiving multiple transfusions. Transfused red blood cells contain iron that can accumulate in your body and can damage your vital organs with iron overload. Medications called chelating agents can help your body get rid of this excess iron.
How long do sickled red blood cells typically survive in circulation?
A normal, healthy red blood cell lives about 120 days, but a sickled cell survives for only 10 to 20 days. The body is not able to reproduce new red blood cells fast enough to keep up with this rapid destruction of the sickled cells. This results in a chronic hemolysis and anemia.
Which of the following is one of the 4 key findings in Tetralogy of Fallot?
Let's start with an overriding aorta. In these patients, there is that connection between the 2 ventricles called the VSD. The aorta rides over that VSD and allows the mixed blood to go into the aorta. That's why these infants are cyanotic. Some of that right side of blood is shunting to the left through that VSD and up into that overriding aorta.
Which of the following genetic disorders is associated with pediatric cardiomyopathy?
Examples are metabolic storage diseases such as Pompe's disease, conduction defects, mitochondrial disorders, ion channel disorders, muscular dystrophies. All of these genetic problems can cause a cardiomyopathy, and they'll be different depending on the cause.
A child's ECG shows a QTc interval greater than 450 milliseconds. Which condition is most likely?
In patients with a prolonged QT at baseline, they may have a syndrome that's causing that. There are 2 relatively well-known prolonged QT syndromes that are genetic. One is called Romano-Ward, and that's the most common one. And another one is less common, which is called Jervell-Lang-Nielsen. That one's interesting because it also comes with deafness in the family.
That's it for today's quiz. Count your stars and let us know how you did in the comments. Keep mastering those core Peds concepts, and we'll see you next time.